Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN, Healthy World, Healthy Nation, Healthy You. I'm Nancy Valentine, Ph.D. and registered nurse, and this show is dedicated to you, the healthcare consumer. And today we have a topic that is in a field of study that I think will be new to most of us. The field of study is called chronobiology. And the title of our show today is how chronobiology, which we will explain to you what that is related to cancer. Our show is Chronobiology and Cancer, the science of getting prevention, treatment, and recovery in sync. Now you may be asking yourself, what does that mean? Well, we're going to boil it down to size so that when you finish this show, you're going to know how your rhythms, your biological rhythms, really play a very important role in your treatment plan. And we're also going to talk with you about how, if you do have cancer or you know someone that has cancer, how this field of chronobiology can really help them to get better. We're going to talk about the prevention, the treatment, and the recovery, and how the science of this field can really make a profound difference. It is a fascinating field. It's something that I've learned a lot about from our guest today, who's returning for another show on this topic, Dr. Donald McEachron. And let me tell you something about this really amazing person who has written many books and articles, but is really a down-to-earth teacher. He's teaching professor and coordinator for academic assessment and quality improvement, the School of Biomedical Engineering, Science and Health Systems at Drexel University. He is a neurobiologist by training. He has a Ph.D. in neuroscience from the University of California in San Diego. I love San Francisco, so that's probably why I made but I love San Diego too. But let me tell you, among his many other things that he has done, he's written this book on chronobioengineering. So let me just walk you through what that word means. Chrono, we're going to talk about, and he's going to explain to us what these rhythms are. And these are just basic biological rhythms that we all have. Our whole body operates on these rhythms. Bio has to do with living things, in this case, us, and engineering, meaning making things. So it's really a book. In this case, it's a textbook. It's not something that you're going to pick up and read for your bedtime reading. But as I went through the table of contents, he has really taken this field of chronobioengineering and he has really applied it to all kinds of illnesses. Today our topic is on cancer, but he has chapters in this book about how this field applies to many other disorders, heart diseases, etc. So let's really stay focused on our topic today, Don, and I think for our listeners, we really need a little chronobiology 101 to tee us up.
Okay. Have you ever had the experience of waking up before your alarm goes off? Most of us just accept that as being nice. We don't have to wait for the alarm. We're ready to go. We feel rested. And compared to those times when the alarm drags us out of bed or we hit the snooze button, waking up before the alarm seems like a good thing. If you think about it, what that implies is that somewhere in your body there must be a clock, something that woke you up in time to get up and get to work or to school or to begin your activities. As it turns out, there is a system called the circadian system, and circadian is Latin for about a day. This particular system runs at approximately a frequency of 1 cycle every 24 hours. And embedded in your brain, in an area called the hypothalamus, there's a master clock called the suprachiasmatic nuclei. Great word. It's sort of a thing that one could do with Mary Poppins, you know. It's a supercalifragilisticexpialidocious type phrase. But this clock synchronizes and maintains your entire body. So if we take a look at this image here that I threw together, which takes a look at how these systems work, what you see at the top is the environmental cycle, the cycle of day and night. This is what we want to be synchronized to. This is the external timing environment. And the little arrow points down to this very large blue item with the rhythm embedded inside. And this says master pacemaker or main biological clock. And that's this clock in your brain that senses the light-dark cycle and shifts its nearly 24-hour rhythms so that it actually matches the light-dark cycle. So if the light-dark cycle is 24 hours long, the master pacemaker has a rhythm that is suddenly 24 hours long. As long as the light-dark cycle and the clock are working properly, both are synchronized, which is what we meant by in sync. Now, if you go down below this big clock, there are a whole set of little ones, all look the same, and I know they look the same because I just sort of copied and pasted them. Throughout your body, you have a set of what we call secondary or subsidiary clocks. This sounds complicated, but think of an orchestra. And if you've ever arrived for a symphony before the concert has actually begun, you can hear each group of instruments sort of tuning up. And it sounds like noise, but you hear a little tune in one place and a little tune in another. When the conductor steps up and raises his or her hands and begins the symphony, then all the pieces of the orchestra become synchronized. They're into the sync. They're in harmony. And it's just like the way your body works. There's a master biological clock that harmonizes, that becomes in sync with the environmental light-dark cycle. And this master clock then synchronizes a whole set of other clocks within your body so that your body becomes a symphony. It has harmony. It's working together to promote your health and well-being.
Now, I think that's great. I think, as you can see, Don is extremely enthusiastic about his life's work, which is to be admired. Now, you may be saying to yourself, oh, that's very interesting, but why would I need to know that? I mean, if I sleep at night and I wake up during the day, what's the big deal about that? The big deal is that your body, has to really have enough sleep. And we've gone through some of the explanation of that in other shows that Don has done for us, and he has given a magnificent explanation of why this is so vitally important. But for cancer, it's even more important to think about these rhythms because they really have a lot to do with how you can prevent cancer to begin with, how if you do have cancer, how these rhythms play a role in how your treatment is going to be designed for you, to be customized to your rhythms. And then he's also going to walk us through the recovery and how you need to be aware of your rhythms because they will very much influence your successful outcomes in your recovery. Now, this is, for many of our listeners, is going to sound almost like hard to really envision. And I think that part of what we're doing, and these shows are dedicated, is really to bring it down to size so we can leave understanding this. So let's start with the prevention. If people thought that they might have some proneness to cancer, say they have cancer running in their families, they have some biological markers, etc., can they really do some work in prevention by following these biorhythms more carefully? What are your thoughts on that?
Apparently, now this science is fairly new, but recently we have begun looking at shift workers and the possibility that shift work, which disrupts this symphony, which tends to cause desynchronization is the fancy term for it, that they might be more prone to developing cancer. And there's some recent studies in nursing and night shift indicating that there's the possibility, at least, that this kind of shift work might predispose people to developing breast cancer. Now, animal studies have been done where animals have been injected with material or tumor cells that would cause them to develop a tumor. And they place these animals in conditions that mimic shift work, where in fact they are shifting the schedule and they're disrupting these animals' circadian rhythms. They're disrupting the symphony. And what's happened is that the tumor growth accelerates. It appears that disrupted circadian rhythms can, at least in these animal studies, make a situation where a tumor has already begun make the tumor grow faster. Now, we suspect that by maintaining the proper symphony, by maintaining the proper synchronization of your biological rhythms, by maintaining a fairly stable schedule, by sleeping sufficiently, that you can actually reduce the risk. Now, this is a hypothesis, an idea. This is not something that one has completely established. The experiments are leading in that direction. So if from my perspective, knowing this field as I do, I tend to say, all right, I'm going to keep my schedule stable. I'm going to try and go to sleep and wake up at least similar times on a regular basis. I'm going to try and keep my feeding when I eat on a fairly regular schedule because I am going to play the odds. And my knowledge of biological rhythms tells me that having a symphony is better than having everybody tuning up independently. And so I am going to follow that schedule in the hopes that indeed that will reduce my risk.
Right. So I think the point that Don has made is that in shift work, which really there are thousands of people that are doing shift work every day all over the world, so we're not going to eliminate shift work. Mm-hmm. And it may not be that the shift itself is what is really predisposing you to, say, cancer risk. It's how you are managing your sleep patterns as a result of having the interference of a night shift, for instance. So what we talked about in our previous show about this is that if you are a shift worker, if you have any other biological problems, whether it's cancer or heart disease, you have to be really super clear about your schedule in terms of getting rest and sleep. You have to restore your body and get it really synced up to a new pattern of these biorhythms. Because these biorhythms, even though you can't see them, you can't touch them, they are there, and they are very much coordinating all the other functions of your body in ways that you can't even see or be aware of, but that nonetheless, that's what's happening. So if you are a shift worker, if you're predisposed to anything, any kind of illness, you just have to be very, very adamant about your sleep patterns. And we gave a lot of tips in that show, which you may want to take a look at on the website to refresh your own memory. If you've watched the show or if you haven't seen it, you can really learn a lot of tips about how to maintain sleep. So these rhythms, I think, in terms of cancer, are very important in terms of prevention. And I think that, again, it's almost like for many of our listeners, almost a leap of faith, since we haven't heard about this before. This is not just something we talk about in the mainstream, but this field of study of chronobiology is not brand new. These things have been studied for many, many years, and they are known facts that sleep patterns must be preserved for health, whether you're doing studies with people or they're doing studies with animals. It's really across the board. They have to be preserved. So it's really our job to point that out and for you to adopt those patterns to do that. But let's get back to our discussion about cancer. So say we've done our sleep patterns and we've tried to be as good about that as possible, but nonetheless, we get a diagnosis of cancer because there are many, many factors that contribute to that. It's not just one thing. So if you are diagnosed with cancer, how does this really fit into the treatment plan?
Okay. Everybody needs to understand at this point that all aspects of your body cycle with a rhythm. Actually multiple rhythms. Again, one of the prominent major rhythms is this circadian 24-hour cycle. So your cell division cycles have rhythms. How your kidney functions has rhythms. How your liver functions have rhythms. And when you are engaged in, say, cancer chemotherapy, you're being treated with certain pharmaceutical agents. These agents get into your blood and they have a certain goal. So for example, they may be interfering with cell division of a certain type of cell, which is the cancer cell that your physician is attempting to eliminate. Well, those cancer cells have rhythms typically. That is, they undergo cell division at certain times of day. And therefore, if the treatment is keyed to that time of day, it is likely to be more effective than if it's simply given at random across the day or in not the appropriate time frame. In addition, chemotherapy agents, pharmaceutical agents in general, have side effects, sometimes very severe side effects. These side effects can be related to how your liver is functioning. They can be related to how your kidney is functioning. And so there's a variation in the severity of the side effects based on time of day. So now you back up for a second and you say, well, I'm getting a pharmaceutical agent. Its effectiveness varies by time of day. Its side effects vary by time of day. Then we should be tailoring these agents for the appropriate time of day for each patient to maximize the effect and minimize the side effect. And for many pharmaceutical agents, for many chemotherapy agents, that is indeed possible. It can be done, assuming that your physician is aware that these effects exist and how the pharmaceutical agent and the cancer they are trying to treat, and it's a match between the two, how they vary by time of day.
Well, that's fascinating. So there are two, obvious questions there. First of all, how many cancer specialists, either physicians and or cancer centers, are really factoring in this whole field of chronobiology in their treatment? I think that's one question, but the other is, when you are assessed for any of these treatments, the assessment usually has to do with urinalysis tests or blood tests or imaging tests, but I don't know that many people are assessed for their chronobiological rhythms, and so how would that be done? So I mean, that's really two very big areas of interest.
Much as I hate to admit this, I think that the use of chronobiology in cancer treatment is minimal at the moment. I do know of certain cancer centers that do list chronobiology. I can tell you personally that if I received a diagnosis of cancer, one of the first things I would look for is the word chronobiology in a description of the cancer center, or I would ask the physician if they understood chronobiology or if they used timing in their treatments deliberately. Because I know that if you do not do that, you are not fully aware of the best treatment paradigm. But it is fairly rare, I think, that physicians actually use this, because I think that they're not really aware of how impactful these time of day effects are.
Right. I'd like to just expand on that for a moment. In terms of medical schools and basic training, is there a crossover between engineering schools, such as you have at Drexel or other places, and the medical programs, so that people at least get some initial training in this field?
Well, I think you're going to find, for example, at some medical schools where they have chronobiologists who are either on staff or working with the students, then you will get an introduction. Again, I think that's probably not common, and it's a minimal introduction that rhythms exist, rather than a broad introduction as to how to use them. Mm-hmm. I think one of the things about Drexel is Drexel is very practically oriented when you have this idea of translational medicine. So the idea is to bring these things out of the field of research and into practical applications.
Right.
So
right.
Those of us at that university tend to be driven in this direction. So I'm trying to work with physicians at our medical school to see whether we can develop this. But there are limitations with changing medical school curricula. It tends to be very designed. It's very packed with material. And so it's hard to get new ideas into the medical school curriculum because you have to put them someplace, and often you have to take something out to put something new in.
Right. That is always a battle. The same thing with nursing curriculums. I mean, this is pretty standard for all the professions. But for our listeners, the people that are really at the end of the treatment, I mean, they're the people that want the best medicine, the best planning. I think you gave us a tip already, and that is if you are dealing with treatment, you should be asking about chronobiology and how this factors in, because as we're learning, this really does have a very important impact in how your treatment is going to be received by your body, and how well it can do. So it's not just like the right drug, it's the right drug at the right time under the right circumstance. So I think that is very, very critically important. This is not a random thing that you can just throw into the mix. I mean, this is a science unto itself. Now, if a person did, in the best of all possible worlds, go to an organization and had a physician that says, yes, I know all about chronobiology and cancer treatment, and we are going to be using that as one of the many factors in designing your treatment plan. What is the individual going to experience? How do they get assessed for their particular biological rhythms?
Well, I have to plead ignorance in the case of actually how this is done in the few centers that are at least advertised that they look at it, but I can tell you how it could be done. The easiest way to do this would be to use something called a wrist actiwatch. It's a little bit like this wristwatch, but what it does is it measures wrist movement, and as it turns out, wrist movement is highly correlated with your state of activity and sleep. And in fact, you can, to a certain extent, monitor the difference between resting in bed and actually being asleep with the data that's picked up by these wrist active watches.
So you only wear it when you go to sleep?
Well, no, you wear it 24 hours.
Oh, okay.
So these things, depending on the type of model, some of them are quite waterproof, so you can wear them in the shower and you can just sort of wear them for 24 hours. Typically, if you wanted to get a really good solid sense of a person's rhythms, you might wear it for a week, but it's just like wearing a watch. And the data is downloaded and people can take a look at your rest activity cycle and get a sense of what your rhythm looks like. Now, if you want to become more, increase the resolution, become more precise on how you would measure the rhythm, you could measure body temperature, you could measure plasma melatonin, that is, take repeated blood samples. One tends to not want to do that across too many days or too many hours because you don't want to be stuck repeatedly.
Right.
So that wrist actiwatch is a nice way to do it with minimal invasiveness.
Right.
But you can do things like have an indwelling catheter and take multiple blood samples. Again, it depends on what your physician is using the data to do and how precise the timing has to be. Depending on the treatment, the timing can be less resolution, like maybe we need to give this drug in the morning. So you might have a 4 or 5 hour window in which that's the best time out of 24 hours to give the agent. Under those circumstances, the wrist actiwatch might be sufficiently precise. But if you're looking at a situation where you think there might be say a 2 hour window or a 1 hour window, if there is an agent where they think it needs that kind of precision, then you need to have higher resolution. You need to take a more invasive look at the rhythm.
Right, right. So I think that what we could do is we could really find out what the few centers that are doing, how they actually administer the baseline to really assess your rhythms. But it sounds like it's relatively non-invasive. It's simple in the whole scheme of things. It's not like having another series of MRIs and very expensive testing. It sounds like it's just being aware. Going to a place that's aware that this is really a very important factor and uncovering that and then tailoring your assessment then to your regime. I think that this could really change how care is delivered. I'm just thinking again of the nuts and bolts that I'm familiar with. Most people get assigned to come into their chemotherapy treatments just based on a list of people that need to have chemotherapy that day. It's not really necessarily about what time is good for you versus someone else.
That's correct.
That could really change our whole system of care.
Well, yes. Again, biological rhythms are fundamental to how living systems work, not just human beings, all living systems. This is how complex living systems are organized. And so everything has rhythms associated with it. And when you want to treat a specific disorder, usually these disorders have rhythmic components, and you can take advantage of that. You can maximize the effectiveness and minimize the side effects. And what's interesting about this is that you can improve treatment outcomes without developing new agents. You do not need to go to the drawing board, as it were, and come up with entirely new agents. You can improve treatment outcomes tomorrow by taking rhythms into account.
That's pretty dramatic. Can you just give us sort of a nuts and bolts example of something that would be effective under the umbrella of having the rhythms factored into the treatment versus something that would not work because it's just being given out randomly?
Well, if I'm trying to think of a particular example, the cell cycles of different areas of the body run with different, what we call phases. So when a particular set of cells is undergoing their cell division,
which is normal, not necessarily
right.
Cancer cells.
Right. Absolutely correct. So you might say, you look at skin cells, for example, they tend to divide at night. Well, that makes perfect sense because we evolve with our skin exposed to sunlight, and it is liable to have mutagenic effects. You could generate mutations with ultraviolet light. So the skin cells have a tendency to peak their cell division at night. That's not true in the gastrointestinal tract, for example. Those tend to peak during the day. So if you are tailoring a drug that is treating skin cancer and you are attempting to interfere with cell division, you would want to give that drug at night because that's when cell division occurs. If you are tailoring something for, say, GI tract cancer, you might want to give that one in the late night, early morning, just before sunrise, because that's when DNA synthesis is actually occurring for that particular set of cells. So again, before we go any further, you need to make sure that you talk to a physician about a specific cancer and a specific treatment. What I'm not doing is trying to give any kind of recommendation for you to tell your physician when you want the treatment, but simply that a physician should be aware that there are rhythms and that these rhythms can in fact be used.
Right. And it seems to me that in terms of what Don is telling us, we also need to be aware of our own rhythms in terms of recovery. So the same as we would get a baseline for our physician to help us with the aggressive treatment in some cases of cancer and really, again, sync that up to our own biology. In recovery, we would want to be knowledgeable the same of our own rhythms so that, again, we really mastermind our plan for sleep and restoration, because that would be vitally important as well in terms of really being able to support ourselves in our own cancer treatment. We have really only touched the surface of this today, and with new fields, often many more questions are raised than answers. But I think that what we've done today successfully is that we've laid out this whole field for your thought and your comments, and for your discussion with your treatment team. So that alone, I think, has some real merit. So just to review our key points that we went over today, is that we did talk about these circadian rhythms and how this chronobiology really impacts our health in general, even without cancer. Once you add cancer into the equation, it becomes even more critical because, as our second key point says, is that the disruption of these rhythms can really have a very big impact on how the treatment is received by the body. So we really want to know that. And the other is that cancer prevention and chemotherapy and our own recovery really has to do with our interplay with our treatment team, with our own lifestyle, with the drugs, with the treatments that we're getting. They all have to match up in ways that we feel like we're in control, that we really are able to be very much a partner with our treatment team and really helping us to get the outcomes that we desire. I hope that you've learned something with this show today and that this has piqued your interest, and that remember, with health, all things are possible. Have a wonderful day. I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening and join us again. And remember, with health, all things are possible.